I knew that I had wanted to go back to school because my history is 18 years in critical care, and I wanted to do something that I could take it to a bigger level. So when I got into nursing, I wanted to help patients to feel better, and what it came down to was just to kind of help make them smile. And then after 18 years, I felt like, okay, I'm impacting one patient, maybe two patients a day. But if I went back to school and became a CNS, I might have the opportunity to impact nurses in the same way, and then they could spread that to more patients. So that was kind of my focus of going back to school. And how I came about Purdue was our director of education at where I work, the Portland VA, has a very good working knowledge of CNS programs throughout the nation and spoke very highly of the Purdue Calumet program. So once she had mentioned that to me, I looked into it, and I too was impressed, and that's how I came to find Purdue Calumet, coming from Oregon. I think the most important thing to me was I have never been a strong student, but I have a very good work ethic, and by doing it online and having the professors that I have been lucky enough to have, I have been able to put in the effort needed to produce adequate grades and to learn from every experience and from all of the material that they provided. I've also had the issues come up, and being a working student, sometimes it's hard to conform with the 9 to 5, Monday through Friday stipulations that people have. And this program has afforded me the opportunity to get in touch with my professors on the weekends, have expedited responses, to feel supported, secured. If I had any questions, they would address them. It just gave me a kind of a holistic educational experience. I think there's two pieces to that. So the online work allowed me to do all my readings, my homeworks, my assignments when I could fit it in, being a mother, a wife, working, the coach of my kids' teams, all that stuff. It allowed me to make it work with my schedule. I think the flip side of that is that when you're doing an online education, you have a list of things that you need to read and do, and you have to do all of it. You can't just go to the lecture, see what the professor might be teaching more to or putting more emphasis on. You have to put an emphasis on everything that you have to learn. You can't just go to the lecture and kind of see what they're interested in. You have to know everything about it. So I think it's really enriched my education, because I couldn't do what I did in undergraduate. I couldn't do in a classroom by seeing where the emphasis is placed in the online education, because we do have lectures, but they're in different format. So, oh gosh. I think their understanding and passion has just been outstanding. I've had several instances where I've had a little bit of difficulty in my practicum experience, and I call or text, even if it's on a Sunday, and I get a response back from the faculty giving me support, ideas of how to proceed, and basically just letting me talk to them. A lot of times I have found in this last semester, well, the last 2 semesters, that if I just talk it out with them, I actually can figure out my way. They don't make me feel stupid for having something happen that shouldn't have happened. They don't make me feel like, well, we know what you need to do and this is what you have to do. They've let me explore my options, kind of probably guided me, but in a gentle way that never made me feel belittled or like I should have already known that. So that's just been, yeah. To anybody that will listen about graduate classes or what kind of advanced practice nurse they want to become, I can't say enough about the faculty and how supportive they've been. So I am an organizational freak. I really like to have things in their places, to go through the process, and to look at it as a big picture. And this program has given me so much insight into how I can do that more effectively, efficiently, and have it come out so that it actually is going to be beneficial to everyone involved. So my goal is to become a CNS, someone that looks at the entire process of any sort of a patient population or a designated group, and sees how we can improve care for that patient coming into the facility through going back to their home environment. And what's even more important, and I've been thrilled about, is that during these clinicals, the didactic part matches up completely with the clinical aspect. So what I'm doing in practicum, I can apply to what I'm doing in my work, because my job has placed me in a position that is what I'll be doing when I graduate. So as I am growing in my work environment, I can apply from what I'm learning in my didactics and in my practical experience right into my work environment. So it couldn't have dovetailed any better for me, because if I have questions that are something going on at work, I can ask my professors who have all the answers and can see different ways of looking at it that I just didn't even know existed. So they've been very helpful.